to be here with my wonderful co-host, Dr. David Casarett, Chief of Palliative Care at Duke, for a conversation that's going to go way beyond medicine. We're talking here with Joanna Doran and Monica Bryant of Triage Cancer about the legal battles that patients face, the hidden toll that caregivers are taking on, and how we can build a system that truly supports people when they need it most. How are you ladies doing today?
Good. Thank you. How are you?
Thanks so much for being here. This is super, super exciting. As you guys know, we're going to go ahead and just get right into it with our lightning round. So for this, if you guys could both give me an answer, we'll go Monica first and then Joanna, and maybe try to keep the answer between less than 20 seconds. So Monica, what's one thing you wish every patient understood about insurance denials?
That they don't have to take no for an answer.
I love that one.
Joanna?
That it's incredibly common and it's not unusual, and that there are steps to take.
I love it. All right, here we go. Biggest game changer in patient rights in the last 5 years. Monica?
Ooh, 5 years. I'm going to expand to 10 years and say the passage of the Patient Protection and Affordable Care Act. It was a game changer for access to health insurance for people.
10 out of 10. Love it. Joanna, what you got?
If I'm stuck with 5, I would say the Inflation Reduction Act and how it capped out-of-pocket prescription drug expenses for people on Medicare.
Ooh, I didn't even know about that. I love it. All right. So, Monica, tell me about one policy change that would transform cancer care overnight.
Universal health care.
I wish. Magic wand, right? Joanna, any insights?
Monica took the easy answer. I would say paid family and medical leave.
I love it. I really, really do. And then one more. Something people would be surprised to learn about you outside that you're a lawyer. Monica?
One of my hobbies is woodworking.
Cool. You're going to have to show me some of that stuff later. That's really awesome.
It's all very utilitarian. Like I like to build shelves and planter boxes. It's not usually pretty.
Still, that's awesome. Joanna?
I would say one thing people would be surprised to learn about us is that we're actually sisters.
I learned that after seeing your oh my gosh, what's it called? Your middle names. I was like, wait a second. So cool. Very, very, very cool. And you guys, I guess this is outside of the lightning round, but you guys just both were passionate about the same topics.
I think we came into this work in an interesting way, but definitely feel like this is an important need that our skill sets lend themselves to.
Yeah. All right. Well, while we're talking, Joanna, I would love to ask, so, you guys have built Triage Cancer into this national resource for patients and caregivers. What gap were you trying to fill when you started this work?
I think the broadest way to describe the gap as a lack of education, but from a really different perspective than most other patient advocacy organizations are approaching these issues. And if you'll indulge me for a second, I'll give you a pretty good example.
Please.
When I was in law school and college, I was actually working at a cancer center for a psychosocial care program. And one of my job responsibilities was actually to fit patients for mastectomy bras and prostheses after a mastectomy because of breast cancer. And I would do that and then have to bill insurance for those prostheses and mastectomy bras. And then I would have to fight with insurance because they would deny coverage for those items, saying it's cosmetic, we don't have to pay for it. And around that time, I actually took a class in law school and I learned about a pretty random law called the Women's Health and Cancer Rights Act, which is a federal law and requires insurance companies to cover the cost of mastectomy bras and prostheses.
Whoa.
And so I would get on the phone with the insurance company and I would say, I don't understand why this isn't covered. It should be covered under the policy because it's a private insurance plan. And they would say it's denied. And then I would say, well, what about WICRA? And they would say approved. And so all I would have to do is throw out the acronym of a law and completely change the outcome of the situation. And that, from a lawyer's perspective, it's unjust. It's not fair that you have to know the law in order to be able to advocate for yourself and get access to the things that you're actually legally entitled to. And so knowing your rights and understanding how the law provides those protections is really at the core of what we do as an organization at Triage.
I love that. I honestly, that was, first of all, thank you for letting us know that law exists, because knowledge is power. And, you're absolutely right, because also accessibility to this information is a huge issue as well. So many people would never even know that this would exist. So you shouldn't have to be a lawyer in order to get the proper healthcare that you need. So thank you for the insight.
We actually say that all the time, that you shouldn't have to be a lawyer to access quality care and maintain your financial well-being and your jobs and your homes. But our systems are complicated. And sometimes it does require knowledge of the law. And that really is, I think, what Joanna and I are so passionate about, is taking that complex information and translating it in a way that someone who maybe doesn't have a legal education can not only understand it, but then practically use it to get what they need.
That's the key right there, to actually be able to use the knowledge that they have. Right. Amazing. I love it.
Great. I think you sort of anticipated our next question, but I'll ask it anyway, because I think there's probably more to delve into, especially now that I know I'm talking to two sister lawyers. There's probably a lot of stuff here. But I'm curious, the kind of work that you do broadly, which we'll hear about more, I think in other settings, environments, the environment that I work at in a health system, that's a lot of work that's done by social workers or nurses. And I'm curious, your lawyers doing the work that people down the hall, nurses down the hall are doing where I work. What are some special skills that you bring as lawyers? Certainly knowing the law, being able to describe it, as you just said. Are there other kind of secret superpowers you bring to this fight, I guess you could call it, as attorneys?
I've never thought of them as superpowers, but I'll take it. I think, Joanna's been doing this work even longer than I have, and I've been doing this work almost 2 decades. And I think what we've learned over time is that it's not enough to just understand the law. The thing that I think we have really honed over years is the ability to translate the law in a way that people can understand it. And that takes different forms, and it's not just one way. So it's about translating the law for the audience in front of us. And so that could be different for someone who is a caregiver versus a healthcare professional. So it's how can we explain the law in a way that they can then take it and use it the way that they need to.
It's kind of like advocacy at its finest. I think that is the core of our medical system. We just need more advocates in general, so that patients can truly understand their rights, what their doctors are saying to them, and all of that good stuff. So
could I ask one follow-up question that we sort of off the script? Just make up a number. This is kind of a impossible question, and this is Joanna or Monica, either one, but what proportion of the work that you do with patients really has a strong legal backstop, like a piece of legislation you can point to as your winning argument versus, it's kind of a judgment call. Some insurance companies pay for this and some don't, and we're just going to make the best argument we can. And there's no federal legislation right answer, but we're just going to push as hard as we can. Does that make sense? How often do you have a law that you could, like for the mastectomy example, how often do you have a law that you could just hold up and say, look, we win?
I wish it were that easy. So I would say, I would estimate like a solid 95% of the time we're pointing to specific laws.
Wow.
When you're talking about insurance, it gets a little more complicated because in any area of law, we're looking at federal law, but we're also looking at state law and sometimes even county or city level laws. So you have to understand it's also layered. But I think that even when there's an absence of a specific law that says, insurance companies have to cover X, there are laws and practice areas and guidelines that help define what's medically necessary. And that's really the legal standard when we're talking about things that haven't been specifically laid out. And there's pros and cons to the fact that we do and don't have laws that specifically say things. When you think about how fast medicine and science is moving right now, especially, if we had to change the law to update like what a particular treatment was the best treatment for that particular medical condition, like all we would do is be like erasing laws and, that's a lot of whiteout to be able to actually try to keep up with that. So the way that the laws are written is much broader to be able to incorporate what is medically appropriate at a particular time.
Yeah, I agree. I had some experience with the medical cannabis industry, and a lot of states have enumerated conditions for which medical cannabis can be prescribed and is effective. And so you've got these state legislatures that are essentially on the hook to keep an eye on what's published in the New England Journal to update legislation as new data comes out, and it's just been a disaster. So yeah, I definitely hear you. Having a little bit of leeway is much more appealing and much more efficient in the long term than legislating every single treatment and intervention.
And since you brought up state laws, I think that's an interesting point, because even when there might be a law that exists in one state, there may not be a law that exists in other states. And we work with people across the country. And so sometimes when we bring up the absence of a protection because someone lives in that particular state, it is helpful to remind people, to your point, that there is advocacy that's necessary. And if people want to see changes and improvements and additional protections in their state or at the federal level that don't exist, that is going to require them to actually be an advocate for that change.
Yeah.
Absolutely. Absolutely. So, kind of along the same lines, like maybe I'll direct this one to Monica, but was there a single moment with a patient or a family that kind of made you think this is exactly why Triage Cancer needs to exist?
There is no possible way that I could come up with one single moment. I will tell you candidly that there have been countless times where Joanna and I have been sitting next to each other. One of us hangs up the phone with a caller and we turn to the other one and go, what would that person have done if they didn't talk to us?
Yeah.
And I don't mean to say that we're like these, have superpowers, but it's about, the fact that we often are answering questions that people didn't even know to ask.
Yeah. And
so to come up with a single moment, I can't. We have these moments all the time. And I'm thankful that we are able to provide that help to people.
Well, I'm thankful that you guys exist, because honestly, like I really do understand what you're saying, because we are running Counterforce Health right now, where we're helping people fight denied health insurance claims. And this company has existed like 7-8 months now, and already we have saved people like cumulatively millions and millions of dollars in denied health insurance claims. And I'm genuinely like, what would have happened? Would these people have just like not gotten the care that they needed? Would they be in medical debt for the rest of their lives? Would their entire like livelihood be ruined? And it's like heartbreaking to think about these things. And sometimes I'm like, I wish we lived in a like world where these services didn't have to exist, but I sure am grateful that they do.
Well, I just want to say we are too. Just yesterday, my husband is a firefighter, and he shared with me a post that he saw on social media from the wife of a fellow firefighter who was posting a GoFundMe campaign. And he showed it to me because in reading through that experience that her husband was going through, the immunotherapy that he was recommended for care was denied by insurance. And instead of understanding options for appealing, they started a GoFundMe campaign. And so I think it's a really good example of why there's such a need for help
Yeah.
navigating those insurance denials.
I mean, what is it? Like 99% of claims that get denied don't get appealed. And it's mostly because people don't have the time,
Time or the
resources.
energy, or they just don't know.
Yeah, they literally don't even know that they can. Yeah. Wow. It's heartbreaking. Absolutely heartbreaking.
Yeah. Could I ask a follow-up question? I'll direct this at Joanna and then let Monica weigh in. If you could kind of have some magic time machine, and you could, instead of working with patients who maybe have metastatic cancer, are fair ways down the illness trajectory, what if you could backtrack in time and talk to patients and their families a little bit before they're diagnosed? And you've got somebody who is going to get this diagnosis in the next couple of weeks, and you can see this journey ahead of them. Is there any advice you would give to patients and their families early on, like even before a diagnosis, when this tsunami is about to hit them?
Absolutely. In fact, we actually rolled out a whole program called Triage Health in the
cool.
hopes that we can actually reach people earlier before they're diagnosed with chronic or serious medical conditions. And it's really about teaching people all the things that we teach people every day, but before they're in a crisis moment. So understanding how to pick the right health insurance for them, understanding how to actually get access to care, like screenings and early detection services, understanding how insurance is supposed to cover those things, understanding how you can take time off under the law to be able to even go and get access to those screenings. So really, it's a lot of things that we talk about all the time is the things that we should all be taught in high school, so that we can, navigate adulting, but that we aren't ever taught. We only really learn these things once we're in a crisis moment, and then it's a whole lot harder.
And can people find that at triagecancer.org, or is that a separate entity?
It is a separate site. It's triagehealth.org, and so people can access information there.
We'll go ahead and put all of this information in the LinkedIn comments as well for anyone who may be interested in learning more. And of course, just the Triage Cancer website too, because, you guys are doing the Lord's work. So thank you. So, I feel like there's a lot of the times people who are working professionals and like super successful in their lives and careers, very far away from the medical field, like a CEO at like a Fortune 500 company or something like that. Well, maybe not. Maybe just someone, a working professional. They think that, HR and my insurance company is kind of going to handle this. What would you want them to understand about how much actually falls on the patients and the families and what they really need to truly prepare for? Maybe Monica, if you can take that one.
Sure. I think that people really shouldn't be relying on their health insurance company or even their HR teams to understand what they have access to or what their rights are. I think, insurance companies sometimes have case managers that can be very helpful. HR people can be very helpful in guiding people through the process. But I don't think that people should rely on others for a basic understanding of what their rights are or what benefits they have access to, that they really should be informed consumers of healthcare and informed employees, because who's going to be a better advocate for you but you?
Absolutely. And would you say maybe a good place to start is just by going to the Triage Cancer website?
Absolutely. And certainly if someone isn't in the cancer community, to Joanna's point, Triage Health, this is information that every single person should have at least a basic understanding of. We all should be making informed health insurance choices every single year if we have more than one choice offered to us, whether that's through an employer or if someone's going out and buying it on the marketplace. You need to understand what that coverage is, just like you would understand the differences between two computer types before you made a big purchase decision, right? We as consumers do so much research and spend so much time on big purchasing decisions. The same should be true for your health insurance, because that choice, yes, I would also argue even more so, because that choice is going to potentially dictate what care you get access to and how much you're going to pay out of pocket if you do need to access medical care.
And the information is there. You just have to kind of go dig for it and find it if it's not as readily available as it maybe should be.
Yeah.
I'm just curious, why do you think people are so quick to accept the insurance that's on offer without scrutinizing it? I'm just thinking there's sort of this aura of trust.
People don't understand it.
Yeah.
People don't understand it. There is data that shows that 96% of Americans can't even define the 4 most common terms used in health insurance.
Yeah.
You don't understand the words. How can you be a savvy consumer?
Mm-hmm. Yeah, that's such a good point. But is that like, it almost feels purposeful at that point. It's like, there's like this gap that they're trying to create of like, oh, like using jargon and like bombarding you and being like, oh, you don't know what that means? Then, just that's your fault. You get what you get at that point.
So should there be sort of the equivalent of like nursing home compare or hospice compare, a star system that Medicare sets up that rates the quality of nursing homes in ideally easy to understand ways? Could you imagine, there probably is out there that you would know if anybody does, insurance compare, or you get a summary of benefits and premiums and comments, star ratings?
Yeah.
There are star ratings in Medicare for Medicare plans.
Right.
And there are ratings in marketplace plans, but I don't think that there are for employer plans.
Yeah, that's that. I mean, even Apple on their website has the comparison between the different iPhones that you want to buy. And that's just like a cell phone, but it has nothing to do with your health and well-being. So hey, maybe we should create that. Maybe we can go ahead and create that database and allow for people to make those decisions a little bit more informed. But, I kind of want to really kind of go into more so the caregiving side of cancer, because of course, you go through a cancer journey yourself, but your loved ones and the people around you are experiencing that to some extent too, and caregiving responsibilities, of course, like emotional, financial strain, things like that. So a lot of the times our caregivers are juggling jobs, children, and the health system all at once. What protections exist that most caregivers don't necessarily realize that they have, if any? Maybe Joanna.
I think that when people think about caregivers, the law that probably pops into most people's head is the Family and Medical Leave Act, which is the federal law that allows caregivers to take time off work to care for a spouse, a parent, or a child. But it is unpaid leave, so that's a real downside to the FMLA.
I didn't know that.
Yeah, I mean, it provides job protection and it provides health insurance protection if somebody gets their health insurance through their job, but it's unpaid. And the truth is that only about 50% of people in the US actually even have access to the FMLA. And then most people don't actually use it because they can't afford to. So even when they qualify for it, it's not that useful because most people can't afford unpaid leave.
Right.
So we haven't seen the federal government solve that problem yet. We came pretty close in conversations around the Inflation Reduction Act. There was a move to add paid leave to that reconciliation bill, but it didn't happen. So states have stepped up and have passed state laws that provide paid leave for caregivers. It's an ongoing process. So, even there are states that have already passed laws, but it hasn't gone into effect in their state yet. And then we have a handful of states where it's been law for a while. So I think that's something that people don't realize is the FMLA is unpaid, but there might be a resource available to them in their state.
Do you have a suggestion for, is there, for folks who are maybe wanting to find out if that's applicable for their state, what should they look up?
So we actually have a chart of state laws on our website at triagecancer.org. And so you can actually look up the employment specific laws and find the chart for paid leave.
Okay, that's great to know. So everything can be found on the Triage Cancer website. I love it. That's great.
Not everything, but we try.
Thank you, guys.
Maybe to shift gears a little bit, since we're starting to talk about caregivers, and just looking in the comments there's at least one question about caregiving. What are some of the caregiver questions that you get asked that are most poignant and most meaningful to you?
I think one of the most meaningful questions is really like, what am I missing doing to support my loved one? I also think that sort of one of the hardest things to talk to caregivers are about the lack of income replacement options. So if a caregiver has to take time off, to Joanna's point, if they don't live in a state with paid family leave, there really isn't a there aren't a lot of options. There are a handful of them, but there aren't a lot of options. And I think that comes as a big surprise to a lot of people. Whereas if we're talking about income replacement for the person who's been diagnosed, they might have access to disability insurance. An equivalent doesn't exist for a caregiver.
Wow.
So fascinating to say that. I was working in Thailand a few years ago and was seeing patient after patient who basically had to give up their work, the farm, lose their job to take care of caregivers. And I mentioned that to one of the oncologists, that was so tragic. And this oncologist had trained at the University of Chicago. And she said, well, yeah, it is tragic, but keep in mind, the United States is no better, which was both true and humbling. I don't think we do that much better than other countries and rural areas that we really should be ahead of.
We definitely don't. I think the other piece of that is we also know that there's a whole lot of data where when it's children who are diagnosed with a medical condition like cancer, one parent typically stops working. And so that person has a long-term career impact, but also the family income level also takes a hit as well.
I do feel like to some extent there is still a stigma when it comes to caregiving. And when it comes to, taking time off to care for someone and having those quote unquote resume gaps or whatever the case may be. But the thing is, the numbers don't lie. And I think it's almost 60 million Americans are taking care of a loved one, whether it's a spouse, medically complex child, or like their aging parent. So that's 1 in 6 Americans that are dealing with this, but it's not nearly talked about enough. And I feel like our government could be doing so much more to kind of like support. And it's great to know that these conversations are kind of being had behind closed doors, maybe not being quite passed yet, but at least it's good to know that it's somewhat top of mind, because especially with how quickly our population is aging, we kind of need to act quickly.
And then that doesn't even touch on the fact that there are, what are referred to as solo agers. So what if you don't have a family who can take care of you? How are we building a caregiver workforce in the United States to be able to manage an aging population, even when they do have family members who can support some of that caregiving? But then there's a lot of people who don't have anyone who can care for them. And that comes up a lot in the cancer community. Like when somebody has a transplant, they won't release you if you don't have a caregiver who can take care of you for the first couple of weeks. So what does somebody do in that situation?
And that's really silly because folks stay in the hospital. Like, what's cheaper, to pay for somebody at home with a caregiver or somebody at a high level of care at a place like Duke or Stanford or Harvard? Financially, it makes no sense whatsoever. And
mentally, it has like an impact on the patient too. I feel like being in the hospital for that long can't possibly like help with the healing. I feel like if you're at home, generally you're going to heal a little bit better, especially when you have the structured support in place.
Yeah, there just haven't been that many really big innovations in caregiving. Nirvana's the company that she works for, Caregiver, matches pre-health undergrads with older adults who need companionship. And it's not a one-stop shop. It doesn't solve all the caregiving needs. But that's, to my mind, like one of the single biggest innovations in caregiving we've seen in the last 10 years. There's just so much innovation going on in tech and other places. But this caregiving need that we all have, like everybody's just relying on overpriced home health aides that nobody can afford. And that's the model day in and day out. We really need more innovation in that space, I think.
It really is hard.
No one buys long-term care insurance either. So, there's not even a way to pay for it.
Right. No, absolutely. And then the thing is, it's an industry that's kind of been stuck in like the 90s, if not the 80s, for so long, where profits are constantly being put over people, and it's resulting in the quality of care not being so great either. So it's not just that it's expensive care; it's that it's not the greatest care either, because the current typical caregiver is overworked, underpaid, and underappreciated. And that leads to really high burnout rates. And at a time where we need more and more and more caregivers because of how fast our population is aging, this is just not how we should be treating them. So yeah, there's, of course, Caregiver is trying to kind of make a difference in the companionship side of things, but there's so much more that could still be done in this space. But I do kind of want to shift gears back towards insurance a little bit, because I would love to know, again, kind of like a magic wand type of question, but if you could redesign the insurance system from scratch with patients in mind, what would it look like? And I kind of want both of your takes on this, because I'm curious to know if you have different answers. But Joanna, I'll let you go ahead and take a stab at it first.
Well, Monica started by saying universal health care. And I think, that feels very politically charged to say it, but a single payer healthcare system, which is not focused on profit from a business model, is really, the best way to focus on access to quality healthcare. So I would say if you can remove the business from healthcare, then that's really the most effective way to create a model with patients in mind, and that it has to be whole-centered patient care. So it's not just about treating disease, but about preventing disease and addressing contributors to disease, like social determinants of health, and looking at it from a more public health perspective.
Right. I wish that I could get that printed and put on a little wall, like a motivational thing for people over profits. Please, please, please. Yeah, absolutely. I love it. Thank you. Monica, anything to add?
Joanna really didn't leave me much more to add, because I think that really is the key. For every law that gets passed to try to address barriers that are put in place, like utilization management practices, insurance companies are actually pretty good at finding workarounds or additional utilization management practices. And so the law is sort of never going to be fast enough to keep up with the business side of health insurance.
It's really good. Really, really, really good. We are running out of time here per usual, because the conversation is amazing and I've been really enjoying it. So Dr. C, do you want to maybe pick one more question you would like to ask, and I'll pick one more question I'd like to ask, and we can then go ahead and jump in with our audience questions.
Yeah, I need to make one up. This is fun. So, Joanna, you mentioned that universal health insurance has become sort of a hot button topic. And without making this too political, because this is obviously, it's been a hot button topic for a while across administrations. Why do you think it is? Like, everybody needs healthcare. The government has a long track record of taking over industries and other organizations that aren't performing. Why is everybody so averse to this idea of universal health insurance?
I think, unfortunately, because it has been politicized, there's always been a difference between people who think that government should be more involved in creating a system that speaks to equity and access to quality healthcare. And then there's people who think that that isn't the role of the federal government. So from a merely, two sides of the coin, that's the perspective. But I think the politicization of the issue has come at a time where everything is being politicized. And so, we hear people all the time say, like, well, I don't want government in my healthcare. And then we ask them what type of healthcare they have, and they tell us they have Medicare, but that they love their Medicare.
Keep government out of my Medicare. Yeah.
Yeah. No, and it's partly because people don't understand how our healthcare system works. And where the government does play a role and does provide protections that maybe don't exist in other types of insurance, like capping out-of-pocket costs for prescription drugs. So there's part of the challenge, and we say this all the time, is if we're trying to educate people about the system and how to improve the system, people have to understand the system first.
Oh yeah.
And so that's literally the hurdle we try to climb every day, is to try to teach people about the system so that it does lead to advocacy changes.
Yeah.
Great, thanks.
I feel like that's kind of the question, the thing we just keep coming back to is education and knowing things. And so I guess kind of along those same lines, maybe what's a question that every patient or caregiver should be asking their insurance company, but most people aren't really doing. Monica, you want to take that one?
I don't think there's a single question. I think it's a whole bunch of questions. I think it's making sure people understand all of the different costs involved. So what is the monthly premium? What's the annual deductible? What's the cost share? And most importantly, maybe this is the one question. What is the out-of-pocket maximum for that plan? And what's included in that out-of-pocket maximum? Because that's a dollar figure that represents the most you're going to pay out of pocket for your healthcare for the year. And so a lot of times we will have physicians or people tell us that their physicians have said, I can't tell you how much your cancer care is going to cost. I don't know. We don't know yet how much your total cancer care is going to cost.
Right. Yeah.
Which is fair. They might not know the actual cost of it, but guess what? That cost doesn't actually matter to the patient.
Right. There you go.
What matters is what's their out-of-pocket maximum. And so, we went back to knowledge, and that I think is such a key piece. And listen, that out-of-pocket maximum might be a very high dollar figure, and that might be stressful by itself. But you've taken that stress from, okay, now how am I going to pay for this expense? Which is a different type of anxiety potentially than I have no idea what that cost is going to be.
That's a really good point. Is there a number that people should be like, okay, if it's above this, then definitely don't go for this plan? Or is there something is there a guideline that people could follow maybe? Or is there something that's normal or average maybe that they should know about?
Joanna, you want to take that one?
So I don't think that there's a normal number. And we sort of have exponentially seen out-of-pocket maximums increase over the last 5 years even. There is a cap on the out-of-pocket maximum for all the plans sold in the marketplace plans. So each year there's a different dollar figure where plans are not allowed to have an out-of-pocket maximum higher than a certain amount. That doesn't exist in employer plans. So employer plans can frankly pick their own out-of-pocket maximum.
Wow.
So I would say if somebody was looking and had an employer plan with an out-of-pocket maximum higher than a marketplace plan, that they might actually want to be looking to see what their other insurance options are. And we say that all the time. Even if you get insurance through an employer, it is valuable to look at all of your options and pick the best plan for you.
Yeah. I love it. That's great. And, it's good to know that there are safety nets kind of in place, but makes you a little weary knowing that, it could be $1 million or it could be $100,000, and you just should probably ask and figure out what the actual answer to that is. I do want to give our audience some
good ones.
Yeah, there are some good ones. There are a couple that we've kind of talked about. Ethan asked about a piece of advice you would give for someone starting their caregiving journey. So we kind of talked about that.
Look at Maggie's.
Oh, we'll do Maggie's. All right. That sounds good. We have, thank you for being here and sharing your experience and insights. Yes, of course, I did that sentiment. I'd love to know she'd love to know what are some things that give you hope when you think about the future of caregiving or cancer care. I love that. We've kind of I've been talking about the positives, but this kind of will lift us back up. Maybe Monica.
I think something that gives me hope is how many awesome advocacy organizations exist and what great work is being done in those advocacy organizations. I will also say something that gives me hope as I'm feeling as though we are having more and more conversations around the inadequacies of protections and safety nets. And that, I think, is the first step necessary for change. We have to talk about the problem before we're going to actually see some change.
1000%. Joanna, was there anything you wanted to add to that, or ditto her sentiments?
I would definitely agree with that. I think also because this question was sort of broad, it also said cancer care. I think we've seen massive advancements in the science. And the number of, I used to be able to actually, and I'm not a doctor, but I used to be able to name most of the chemotherapies that were available to treat cancer. And there's no way I could now. And so that really speaks to how far we've come, even in 25 years. It's a completely different landscape.
Wow, that's incredible. The science is advancing every single day, and that genuinely puts the biggest smile on my face, because people are getting to live longer lives, more fulfilled lives, and live with cancer. Like, cancer is no longer like, you have cancer, this is final. Like, it's like people are actually like living their lives and going about their days with a cancer diagnosis, which is beautiful and amazing. And you know what? Maybe in 100 years from now, that people will live with cancer for 50 years and they'll be completely okay. This one is another one that I like. We have Esther, who is hoping to become a future occupational therapist. And she's wondering, from your perspective, what's one legal issue that every future healthcare provider should be aware of, even early on in their careers? Joanna, I'll pick on you this time.
That's a really tough one. I mean, I think maybe actually I would tie it back to appeals. I would say that every healthcare provider should understand the appeals process. Because if a healthcare provider is prescribed care for a patient and an insurance company has said no, that provider really needs to understand how to make sure a patient gets access to the care that they need. And the appeals process is the way to do that.
Monica, anything to add there?
I think I would agree with that. I think the only other thing I would add is to not make assumptions about patients' ability to continue working or not.
Okay.
We hear a lot from people that their healthcare providers basically tell them, why you can't work, or why would you work, just go out on disability. And there's a whole bunch of reasons why that's challenging. And so I think I would want healthcare professionals to really think through what their patients' goals are related to work, and then to understand what rights and benefits those patients might have access to continue working if that's what their goal is.
That's a great.
Which is odd, because I know so many doctors in particular who faced significant diagnoses but continue showing up to work every day because it's their life. They need the income, they need the tuition benefits for their kids, whatever. So it's mystifying to me why those people who show up despite a diagnosis of lung cancer, for instance, and are out on the wards, why don't they give patients the same benefit of the doubt? But I think we tend to be protective of our patients.
There's a whole lot of reasons why people work outside of a paycheck and benefits, right? Like, I go to work because it brings me joy and a sense of purpose. And so I think it is just important, again, if the patient's goal is that they do want to take that time, then yes, of course, let's talk about disability insurance and job protected leave and all of those things, but to not start with the assumption that the best thing is to say,
if I was told, hey, you can't work because you should go on disability, I'd be like, I'll probably deteriorate way faster if I don't continue to work, because it's gives you that energy and fresh air in your lungs every day. And it's I don't want to say it, but sometimes I feel like I maybe am a little bit of a workaholic, but it's good because I love it and it brings me joy. So that's I definitely get that. And especially when you feel like you are making a difference, that really does make a difference. This is another good one, kind of along the same lines, but maybe slightly different. But Brinley's asking, as a student interested in healthcare, what do you guys think is the most important ways law and medicine need to work together better? Monica?
I would say that providers can't assume that talking about the law with their patients is someone else's job.
Oh, okay.
For example, we hear a lot of doctors when questions around financial well-being or employment rights come up, that the doctors will say something to the effect of like, oh, you should go talk to the social worker.
Guilty. Yeah, because I don't want to say anything wrong, which is really, really likely if you get me talking about insurance.
Sure. And certainly we're not suggesting that a healthcare professional be giving legal advice, but there's a difference between advice and information. And having a conversation with their patient about goals and wishes and concerns around finances and employment could potentially inform treatment decisions.
Absolutely. Yeah.
And so it can't be somebody else's job. It has to be everybody's job, in my opinion.
We sometimes just wear blinders, like we're going to look at the EKG and then write a prescription, and that's our lane.
But imagine about looking at somebody's survivorship outcomes and how, financial toxicity actually has physical and mental impact on a patient. You could provide a patient with the best treatment, but those things are going to impact their survivorship outcomes. Proactively having conversations, even if you don't know the answers to those questions, but bringing up the topics for conversation and then making sure that patients get referred to the entity or person who can have the right answers. Like having the conversation is key.
Absolutely. 1,000%. And I'm going to just do one last one here. Pallavi is asking who's interested in being a future physician. She's wondering how you guys see the role of, I like this, legal advocacy evolving as cancer treatments become more advanced and therefore more expensive. You guys are kind of talking about how the innovations are happening, but maybe there might be like a downside to that. But what do you guys think about that question? Maybe I'll let Joanna start with this one.
I think that the advocacy role of healthcare teams specific to access to cancer treatments is going to end up being around access to quality insurance coverage and how those treatments are being paid for, and making sure that there's equitable access as well across all types of insurance, because I think in the United States, that's a factor as well. So I would say, it's not just legal advocacy, but maybe it's also legislative or policy advocacy too, to make sure that our systems are set up to make sure that those really amazing advancements are accessible.
Policy reform. I love it. Any 2 cents or last minute thoughts you'd like to add, Monica?
I think she said it perfectly.
No, well, I think you guys both said everything perfectly. And this was such a wonderfully insightful episode. And we probably have about 15 more questions that we can ask you guys, if not 15 million. But so maybe we'll have to do a follow-up episode in a few months. Maybe once a new policy passes or something like that, then we can reconnect and chat some more. But I really, really, really appreciate you guys being here today. And
Thank you. This was so much fun. And we learned a lot.
Yes, and I hope you had as much fun as I did.
We did. It was a great conversation. We appreciate it.
Well, thank you guys. And I'll put all of the information for our audience in the comments regarding Triage Cancer and the amazing work that you're doing. But thank you guys for those at home for listening, and for my wonderful co-host, Dr. Casarett, for being so amazing per usual. Bye, everybody.
Thank you both.
Thank you.
Thank you.